Good morning, everybody. I'm delighted to welcome you all to Yale New Haven Health. I'm Chris O'Connor, the President and CEO of Yale New Haven Health System. And it truly is an honor to welcome this distinguished panel that you will hear from this morning to reflect on the last 3 years. It is truly remarkable the way that this state persevered through the pandemic. And obviously I will have a chance to introduce him, but I want to formally thank Governor Ned Lamont for his leadership and transparency throughout the pandemic, which has been lauded nationally, but we can't thank him and his team enough for the support that the state government provided to all hospitals and healthcare institutions throughout the pandemic. On March 9th, 2020, our first COVID patient came through Bridgeport Hospital. And since then, we have cared for over 36,000 COVID positive patients across Yale New Haven Health, which is quite remarkable. Our caregivers, nurses, physicians, respiratory therapists, environmental service, transporters, and our entire team have been nothing short. I can be an AV man too. Of extraordinary during this time. As an academic health system, our collaboration with the Yale School of Medicine led to innovation and scientific advancements that made their way to help treat patients with COVID at a time when little was known about the disease. These advancements have helped us achieve amongst the lowest mortality rates in the entire country. We also stood up a community call center that was a critical resource for our families. Our laboratories were leaders in testing for the virus, and we're very proud to have provided over 250,000 people vaccinations. Our teams have also been resilient, coming in for shifts, providing exceptional care for our patients and for one another. Unlike many other organizations, we never furloughed any of our staff at the height of the pandemic. When much of the world shut down, we were obviously very open. And this is an important fact because hospitals are not only the beacons of hope for the sick, but are also an economic engine for the state of Connecticut, and we are happy to play that role. As the public health emergency expires, we are planning for the future, but there are clear and significant headwinds that healthcare providers in Connecticut and across the country are facing. Just like we did during COVID, we look forward to working with our partners in the state and federal government to ensure we continue to provide the highest quality, most innovative, and compassionate care to all the patients we are privileged to serve. Again, thank you for holding this milestone event at Yale New Haven. The timing couldn't have been more appropriate as we are in the midst of celebrating Nurses Week. Thank you to all of our nurses. And 10 days of gratitude for all of our employees across the health system. They are the true heroes of this pandemic and the foundation of our future. It is now my delight to welcome the Honorable Governor Ned Lamont. Governor.
Chris, right back at you. I mean, Yale New Haven and each and every one of you here today, and really all of our hospitals stepped up in a way that I was so thankful for back when we were scrambling like there's no tomorrow. I got to tell you, it's a little like time tunnel here for me because I see Max and Josh and sort of the old team that's front and center. We were on the phone with the hospitals at 7 in the morning and 11 at night trying to work through what we had to do. And as Chris said, it happened fast. I mean, we saw what was happening in Wuhan. We're not naive. We saw Italy. We saw Queens. We knew it was coming. But that day, in early February, when that first infection was announced in Danbury Hospital, and we drove like a bat out of hell there, and standing there, it was an ice chill. And we were all packed in next to each other. Nobody was wearing masks. We had a lot of learning to do. You know, I don't know if you remember, but we had the Surgeon General came up from Washington, D.C. to give us some guidance. And his guidance was, whatever you do, don't wear masks because your hands are going to do something. And sing happy birthday while you're washing your hands because it's all, so we were learning on the fly. And thank God we have some of the best healthcare professionals in the world here in the state of Connecticut. We were able to work with folks like Albert Coe and Scott Gottlieb and each and every one of you. So we've done about 100 of these COVID briefings, so I'll just recreate a little bit of what we're going through, bring it up to date, and then get the folks who really have been on the front lines to say a few things. This first chart, I think, is a reminder why tomorrow the official emergency is declared over. WHO's already done it, the state is doing it, Joe Biden is doing it. What you see there is that blue was hospitalizations. And you see we got up close to 2,000 hospitalizations. And, for Josh and Deirdre and I, hospitalizations was a really key metric because we saw what had happened in other places. We saw hospitals being overwhelmed. And we got close. I mean, the bathtub almost was overflowing, but that did not happen, in large part because when Southern Connecticut was overflowing, Northern, Connecticut, Hartford Health, and Yale came down to help out, and then vice versa. And then what you see there was fatalities. We were losing, about 100 folks a day during those first few months, and a lot of them in nursing homes. And that other graph is not very meaningful, but you can see that it's virtually zero when it comes to May of 2003. And I think that transition, a lot of it was the natural occurrence of a virus, but a lot of us, thanks to some of the really good efforts of each and every one of you and some of the remediation efforts, we made a difference on. This next chart is interesting in a couple of fronts. This is to show you how fast we got hit. It was like a tidal wave. That red line is 2020. That was our D-Day moment. That's when we really had to rise up. And that's where you saw we got up to 700 fatalities per week. And that was another metric that we had a pretty good chance to measure. Although it always got complicated because some states said, if you happen to have COVID, but you died of something else, we're going to say you died of natural causes. Here in Connecticut, we were pretty strict. If you had COVID during those early days, we said it was a COVID-related fatality. And you can see that red line, perched up again a little bit at the end of the year. I think you see in 2022, which is the aqua velvet line, you see that the vaccinations and the masks made a real difference, especially when you can measure by fatalities. This next chart is related to nursing homes. Nursing homes, as you saw, was about half our fatalities during that early time. We know how COVID really hit elderly folks and folks in congregate settings, and you put those two together, that was a nursing home. And I found working with Deirdre, who was leading public health and DSS at the time, a little hit or miss. I mean, our hospitals were consistently really strong. They generally had a stockpile of some PPE. They were generally ready to go. Our nursing homes, some were prepared, some were not. And for those that were not, no excuses. We had to come to the table and do what we could. We were doing our briefings, and there'd often be folks from nursing homes, protesting outside of our briefing, just saying, where the hell are our masks? And, we scoured the globe for masks. Josh took the lead there. Then Carl Keener and Ray Dalio. We got some private sector folks who had very close relationships in China. And it was a day of celebration when those masks arrived at our warehouse in New Britain, millions of masks, and we began to turn, the corner there. I don't know if there's anybody from the Connecticut Guard, but they stood up every day. Hey, General Yvonne. The Guard never stopped. You know, they had just come from a mission in Djibouti, and I said, well, that's great, but we really need your help. We may need some field hospitals down near Stanford Hospital. They may be getting overwhelmed. And by the way, we got millions of masks arriving, and you've got to sort these and make sure we get them to people that really need them. So remember the Guard and give them a salute next time you see them for what that meant going forward. Masks are only good if we could get people to wear the masks. And we tried that, you know, Manisha, Deirdre, and I, we did our best, Dr. Fauci, and said, you got to wear the mask. It's keeping you safe. It's keeping others safe. But we also thought that the masks were an important, we needed to get other folks from the community to tell people how important it was and have different messages, trusted members. I mean, we had masks, and then we have testing, you know, outside of our urban hospitals. So a minister could say, please come out. You know, we had Stu Leonard, you know, put a mask on the cow and tried to say, cows look out for each other, and so should each of you. And I think we have we did a little competition to say who can come up with the best reason you should wear a mask to keep yourself safe and your neighbors safe. Do we have that video?
People ask me all the time, Gino, do I have to wear a mask? Yeah, you got to wear a mask. I mean, they say defense wins championships, but it's more than that. It's about being together. It's about being unselfish. It's about being a great teammate. So do the right thing, and you might get 11 national championships. You probably won't, but wear a mask.
If you have to ask, wear a mask. And that went viral. That went viral for young people, you know, those invincibles, the ones who are a little less likely to have to lose sleep. And it made a difference. That said, you know, I think the press has gotten a little bit wrong, or the politicians, you know, you went into lockdown. That's not exactly the way I remember it. Most of the schools were already shut and shutting down. People were terrified. Our restaurants, Scott, and our retail were already closing down, and the streets were already empty. And we had to push some at the end. You know, we had the basketball championships coming up, and we sort of worried that everybody's going to be cheering their lungs out in a situation where we're losing 100 people a day. So I had to make the call to not do the basketball high school championships that year. A bunch of dads started coming at me with pitchforks. But that night, the NBA canceled. And all of a sudden, people said, this is serious, and we know what it means. And by April, just 6 weeks after that first infection, we started what we called the Reopen Committee. And the Reopen Committee was led by your very own Albert Coe on the healthcare side, Tom and a lot of other folks, leaders right here, and also a great friend of mine who I went to Yale Business School with, Indra Nooyi, who was head of Pepsi, because what we wanted to do was to reopen. But we wanted to reopen only if we could do it safely, and also make sure you feel like you can go back into that store or restaurant and do it safely. And Albert helped take the lead on what we tried to do there. And Albert, just loved it if you could give us a few reminiscences of what you remember from those times, and perhaps how we're better prepared going forward.
Okay. Well, first of all, thank you, Governor, for inviting me to your press conference. Hopefully this will be the last one. But I remember as if it was yesterday, the first time we talked. It was a Saturday, April 11th, 2020, at the height of that first pandemic wave. I was actually in the morgue, right down the street, reviewing pathology slides of a fetus that was miscarried because of COVID. And when you called me, stepped out of the room, and you asked me to co-chair the Reopen Connecticut Advisory Group with Indra Nooyi. And, you know, we're really truly indebted to Indra, who can't be with us today, for her wisdom, her leadership skills, her experience as CEO of PepsiCo, which was really crucial in driving the plan for that early public response to the public health emergency. And in those 2 days, I remember it was between April 11th and April 13th when you announced the Reopen Connecticut Advisory Group. We mobilized the best and brightest from all sectors of Connecticut, from government, your office, business, education, community, our religious leaders, our rabbis, our priests throughout, but also our best scientists, people like Mahmoud Khan and Charles Lee at Jackson Laboratories, our own Harlan Krumholtz, Marcella Nunez-Smith, Linda Lorimer, and Rick Levin at Yale, among others. And I think if there's a lesson learned or a reflection to take home, it was, I think, your guidance and Indra's vision, but developing a plan that was grounded in principles based on social protection. First, prioritizing the health and safety of our citizens. Second of all, ramping up testing capacity and supply chains very quickly. I think we went from, Josh, like 200 tests a day to 20,000 tests a day within 3 or 4 months, so that our healthcare systems could provide the best care for our patients. And lastly, protecting the most vulnerable segments of our populations, those who are hit hard, especially during that first wave where our Latino and our African American population died 5 times greater than our white population. And all of this was done by leading with science, not only believing in science, but leading with science in service of safely reopening our state and our schools, our businesses, in protecting our citizens from the deleterious social and economic impacts created by the pandemic, beyond that of becoming ill with COVID. And that plan set the stage for really the remarkable public health achievements that the state, and particularly the Department of Public Health, led by Deidre Gifford and Manisha Jutani, made. And evidence shows us, there's just a publication last month in the scientific journal Lancet, that Connecticut was one of the best states in the United States in protecting its population during the pandemic. So there's, again, leading by science is, I think, a principle that you gave to Deidre and I, and we, embodied that vision that you gave us. But I think it's really, as I think all of us will do, is really to acknowledge the true heroes, the real heroes of this story, and these are our state and local public health workers, worked around the clock, our healthcare workers, our frontline workers, National Guard, working with General Yvonne day and night for that first year of the pandemic, but also all of our citizens in Connecticut who kept their families and communities safe by getting tested, getting vaccinated, believing in science and public health. So again, it's been a privilege serving you and the state governor, and Indra and I would also like to thank all the members of the Reopen Connecticut Advisory Board for their really tireless efforts in that time of need.
Thank you, Albert. He got a lot of phone calls from me at all hours. I'm pleased and you said in terms of these efforts made a difference. I don't like the narrative out there that the virus just took its course, didn't make a difference. Those first 3 or 4 months, when it comes to fatalities per person, fatalities per 100,000, we were up here and Florida was down there. 6 months later, it reversed. The efforts you put in place made a difference to keep people safe, and I thank you for it. A lot of what we had to do was outreach. You can't over-communicate during a crisis, if I learned anything. And our Lieutenant Governor, Susan Bysewicz, was on, virtually every day with hundreds of municipal officials all tuned in, just saying, how do we tell the story? What should we be doing in Putnam? Talking to the local public health officials, Parks and Rec, what are our rules right there? And my then Chief of Staff, Paul Mounds, now you got him. Damn it. But Paul had to, make sure that all the different branches of government were working together as one, in harmony. And by the way, we had to work with labor, because I was asking You know, you're in corrections, you're in state police, you're in nursing, you can't telecommute. We were asking people to show up, and it was Paul helping to bring together in one voice. Go ahead, Paul.
Thank you, Governor. Thank you to our President and CEO, Chris O'Connor, and the amazing team at Yale New Haven Health for hosting this important event. It is fitting that we are hosting this event here as we are during our 7th day of the 10 Days of Gratitude to our amazing healthcare leaders. Under the leadership of our Chief Medical Officer, Tom Balsack, and our presidents, doctors, nurses, ICU team, and others in the hospital ecosystem, Yale New Haven Health implemented strategies to ensure safety and well-being of those under our care, focusing those efforts on reducing the number of people exposed to the virus, protecting staff and physicians, and diagnosing and caring for COVID-19 patients in the most appropriate environments. Dr. Coe and I were catching up, and as many times we've been on calls together, I think this is only the 2nd time we've actually been in a room together. But he reminded... Actually, it's first. Hey, nice to meet you. I'm Paul. But we were talking about something, and it really connects back to why we're here. During that time, I lost my grandmother in May 2020 after a 15-day fight against COVID. And he mentioned that I was off of a conference call for only a few hours and then immediately came back on. But as we celebrate these days of gratitude, I know to our state's hospital personnel who put their lives put the lives of others in front of those their very own every day, that there are not enough days to express my gratitude to them for what they have endured and the life that they have saved. The first documented case of COVID-19 when it came to Connecticut, I was only in my first week in the job as chief of staff. I pulled the short straw. And I was the first one who had to break the news to the governor that we had COVID-19 in our state. So as the governor went to the area of the state where that virus took place, I went to our emergency operations center to start to coordinate our full all-state response and kickstart what we felt and what we knew was potentially going to be a long journey. A few days later, the legislature granted the governor a declaration of civil preparedness and public health emergency, and for that day forward, the all-state response was truly born. By tapping into the immense knowledge and expertise of our state employees from all of our agencies and the best-in-class minds, as Dr. Coe mentioned, and the leaders throughout the state, ranging from our hospitals, small businesses, nonprofits, organizations, to educators, when it really came down to it, it really was this quote that always stood with me. When it comes right down to it, the only way to face a crisis is together. And that's what we did here in Connecticut. And we did that under the mantra and the guidance of this governor, who placed public health and safety as the first priority. And that's what we did from the first day to this very day today. The creation of the Reopen Committee, which was chaired by Andrew Newey and Dr. Coe, to the creation of the 3-state, then to a 7-state collaborative in which myself and Dr. Coe and Andrew Newey served as Connecticut's representatives. The governor has always told us that a virus doesn't know any borders, but you have to know the people to work with to stop that virus from spreading. While we are in this process of reflection, we also need to remember the toll of COVID-19 doesn't end today and the end of this national emergency. Whether it's learning loss in our schools, small business struggles, nonprofits that provide essential services that look to stay afloat, COVID took its toll, not only on our state, but on our nation. But it made us collectively stronger together. It was truly an honor serving as your Chief of Staff, Governor, during this critical time in our state's history, but I couldn't have served without the amazing people in state government, and I want each and every one of you to stand up and be recognized. So if you served and report it to me at that time, please stand up, because I want everyone to know who you are and what you've done. Lastly, to my former boss and my forever friend, thank you for your leadership. Thank you for entrusting me to be your partner and advisor during this most important time in our state's history.
Right back at you, Paul. Reopening was complicated. I mean, one day I was at the residence, and owners of the hair salons were driving around clockwise going, open now, open now. But driving in the other direction, protesting, were the hairstylists going, hear my voice, don't open. And so I called Paul, said, what do we do now? We opened a week later, but we opened safely. We opened with the necessary partitions and social distancing to keep people safe and the rules of the road. And it was with Scott Dolch and the Restaurant Association, just to give you an idea of how we tried to work closely with small business. There was a head of economic development on our team named David Lamont, and he was on with Scott every night at 11 o'clock, and Scott's wife started wondering, who is this so-called David? But we worked hard to open in a safe and methodical way. I mean, starting off, we had the lifeline of, a lot of financial support to make sure everybody could stay employed. We wanted to be able to hit the ground running. Then it was for pickup. Then it was for outdoor dining. And we took one step at a time. And we did get our restaurants open earlier than just about any state, certainly in the region. And couldn't have done it without you, Scott. What do you remember from those days?
No, thank you, Governor. First and foremost, I want to thank you personally. Seeing so many familiar faces here in the room, I just want to thank everybody, because I think Paul hit the nail on the head that any way to face a crisis is together. And obviously not being a member of the staff, but being, representing an industry, to be able to have those conversations with David Lamont every day, to Paul, to Max, to really try to understand. I actually just drove here this morning. I was in Providence with 15 of my CEOs that run restaurant associations up and down the East Coast. And we were actually we're still, as we talk through recovery and what is going on and what we face with our industry coming out, and how long this recovery is going to take, we reflected. And I am very gracious and grateful for the relationship that we had in Connecticut, because you guys always, we might not have always agreed, but you always listened to the voice of our industry, the voice of small business, and making sure we were doing it right and we were protecting everybody was obviously our number one goal. But at the same time, we didn't want to see businesses close. Unfortunately, well over 1,000 restaurants specifically closed throughout the pandemic. I think all of us here in the room didn't know what to expect in that March, what we were going to be thrown into. It was some of the darkest days for me for the first 3 weeks to 4 weeks, to listen to owner-operators, crying to me on the phone because they didn't know what tomorrow would bring, having to let people go, and what that meant. And, I think the other key to this was communications and how we communicate, having those daily reports, having those conversations to be able to speak to our members, and just, make sure they knew that people were working as hard as they could to help them, and the support that we received. And, I'm very proud of it's been 3 years and where we are coming out of this. And as I look back and just continue to reflect, Connecticut is a phenomenal industry with the restaurants. Many of you probably know, but we are the #1 state in the country for independently owned full-service restaurants. 97% of our full-service restaurants are independently owned. With that said, they didn't know where to turn. Obviously, many of them just were inside their walls trying to figure it out. So for us to be able to keep that and work with every independent restaurant and get them back on their feet, very, very proud of that. But so many people to thank. But realistically, trying to represent small businesses any way that I could. Very appreciative of that, and very appreciative, Governor, of yourself and really your entire team through this process. Obviously, we still have a long road as we try to recover through this and work, and had another closure this morning and a phone call, but know, the challenges that we still face, but know that the support we have from the administration, from legislators, as we continue to come out of this. But so much reflection, from drinks on us to outdoor dining to Omicron to, but I will reflect one moment with, as you think of that second wave, a lot of states around us were looking to close, and we're closing indoor dining. And I'll never forget that the governor was, we had a long talk, his team, and they knew how safe we were making it. We knew we were going to protect, measuring tables, and we didn't, but to know that we didn't close, I think that hurdle for us, especially in Connecticut, saved a lot of restaurants. We know other things did as well, but seeing my peers this week and knowing the relationship that we had, something I'll always remember, and I appreciate everyone here and having a chance to speak today to all of you. So thank you.
Yeah, we were mind melding with Scott, we wanted to do two things. I wanted to get people back to the restaurants, to get them going again, and I wanted more people to get vaccinated. And we ended up getting a higher percentage of our population vaccinated in just about any state in the country, but it took a variety of different ways to encourage people. You know, some states went with fines and punishment. We tried to do a little bit of explanation and a little bit of fun. And Scott mentioned Drinks on Us. This is something we put out on TV, again, trying to appeal to the younger people to get vaccinated and go to a restaurant.
This is great. We don't have to wear a mask. Only if you've been vaccinated.
And free drinks with a meal?
Only if you've been vaccinated.
Have you tried our new drink, the Governor?
Hey, where's my governor?
Coming right up. Governor for you, and a governor for you, and oh, not vaccinated, eh? Get the jab so you don't get stuck with the tab. I don't know. A few more people got vaccinated, I hope. And actually, Manisha Jitani called me up about that time saying, you sure you're opening restaurants at the right time? I'm really worried about this. And we had a pretty darn frank and honest discussion, and she impressed me every step of the way. And we needed somebody to step in because Deirdre was doing double duty, and Manisha now runs public health. I think a lot of you know her from this environment here. And I'd love Manisha just to talk a little bit about what next and how we're better prepared than we were 3 years ago with the emergency over for now.
Thank you, Governor. And I think it says a lot about you and your administration that the person that was maybe complaining about indoor dining and the person leading the charge on keeping our restaurants open all had that same opportunity to communicate with you and brought everybody to the table and brought me into state government to be able to help address COVID as it was still unfolding when I came into this job. So, you know, when I came into this job and took over for Dr. Gifford, she had already brought in a stellar team. So she brought in Lita Orfici, who's here and my chief of staff now, and Barbara Cass, who's here as well, who many know in the hospital setting for helping to lead healthcare quality and safety. And one of their biggest charges, because we know that Connecticut was hit with nursing home patients dying from COVID right in the beginning, was helping to fix that problem. And other areas of the country may not have had that same nursing home wave that we did, but that's because we were hit right in the beginning, right out of New York, and we had to fix the nursing home problem quickly. And the stellar team at DPH under the governor's administration was able to do this. And we are so much more prepared when it comes to nursing homes now than we were all those years ago. When we look at our vaccination rates in our nursing homes, when we look at the ability to prevent infections in our nursing homes, training people up, knowing those best practices that exist, but many people may not have learned in the same way. And nowadays, we are in such a better place with PPE, with infection measures to be able to help people know how to deal with infection prevention so that we are ready for whatever else may come. And you saw from the chart that the governor showed that our deaths in nursing homes trailed off remarkably after that initial wave, which really had to be dealt with by managing infection and learning how to do that, and then most specifically after vaccinations. And vaccinations in our state really were so critical because, again, under Dr. Gifford, under Josh, under the governor's leadership, we in Connecticut chose a strategy that made all the difference. We led by getting our oldest people in the state vaccinated first and went down by decade from there. And what did that lead to? We have over 3 million people in our state population of about 3.6 million that have received at least one dose of the COVID vaccine. Many, over 2.5 million who are completely vaccinated. And in our most recent, with the updated vaccine that rolled out last year, we've had over 800,000 people who received that dose. But all this collective vaccination efforts are what lead to that first chart that the governor showed, that very low number of hospitalizations and deaths that we're having from COVID. Those vaccination efforts made all the difference to be able to get us there. And we now have the ability for anybody to go online on CT Wiz and see your own vaccination status if you need it for COVID or for flu or for something else. And so, I got my first shingles shot and looked it up, and actually there it was on CT Wiz. So we have this resource, which is really an advance for people who want to be able to look up their own vaccine status. And that was something that we got through this vaccination effort. So there is an age prioritization slide on this one that I wanted to just highlight here. And if you see that Connecticut is the yellow line, what I talked about, the goal was really to get our oldest vaccinated first. You can see starting in January of 2021 and onwards, compared to our peer states, the way that the rate of daily COVID deaths just remarkably went down related to vaccinations. And that is a testament to what our healthcare systems, like Yale New Haven being one of them, and all our other vaccine partners that we had in the state, working with the guidance that came out of our state policy on going by age, because we know that older age was our biggest risk factor and continues to be for those people that are going to die from COVID. Through all of this, our testing sites were instrumental. Our healthcare partners and other partners throughout the state, and our National Guard already helped, as we know, with many of our testing sites as well. In addition to testing sites, as a state, we have distributed over 9 million home self-test kits that people were able to use over the last several years. We partnered with FQHCs. You can still go out and get free self-test kits until, the next several weeks to be able to do that if you need some. And going forward, we're going to be able to get these at retail pharmacies and different retail outlets. And also along those lines, why did this virus become so much easier to manage? Because as we went on, therapeutics really became the mainstay of how we can deal with any infectious disease, is to be able to treat it. So early on, we had treatments that were available in the hospital, like you could have gotten right here, that I prescribed when I was on this side of healthcare. But going forward, oral medications have been available, will continue to be available, and be able to help people make it through this. So with that, I want to be able to turn it over to Dr. Gifford, my predecessor at Department of Public Health, and leading the charge in so many other ways now.
If I could just lead in, if I could. What Manisha said on doing the vaccinations by age was CDC made it impossible, I thought. They said, we're going to prioritize everybody who's an essential worker to get vaccinations first, and here are 39 different categories for essential workers. And by the way, anybody who has a pre-existing condition, which could be defined as smoke cigarettes in college, also ought to be prioritized. It was insane and impossible for anybody who's trying to explain in a logical way how to get people vaccinated. And I think we saved a lot of lives by getting those who are most vulnerable by age, a lot less games to be played, and I think it made a big difference and was replicated by some other states later. And the other thing we had to learn, if I learned anything, was we kept talking to the White House, and they kept saying, we've got this stockpile. Don't you worry, we've got a stockpile of vents and masks and gowns, and there was no stockpile. There was nothing there. You pulled the curtain back, and there was no wizard. There was nothing. And, that's why we scrambled as best we could, do what we can. And Deirdre, who was on the front lines throughout, doing public health as well as social services, be prepared to say how we're responsible for our own stockpile. If we've learned that in other ways, we're better prepared than we were before, Deirdre.
Thank you, Governor. And if the governor's asked me to talk a little bit about the future and how we are better prepared if and when there's another pandemic or infectious disease outbreak. But with your permission, Governor, I'd like to say a few thank yous, if I could. First of all, to you. It's 3 years ago Friday, May the 12th, I remember because it's my husband's birthday, that Josh called and said, are you sitting down? And asked me to step into the role at the health department. And it was the honor and privilege of my career to serve on this team. So I want to thank you for your leadership and for really allowing me to participate. There are a couple other people in this room who you've heard mentioned. First of all, Paul, whenever I called Paul, which was a lot, with a challenge, he would always end the call with, I've got your back. And he did, and I knew that, and that made doing the job a lot easier.
I think I threatened the life of a high school kid for you.
TMI.
True story.
The football conversation was challenging.
Yeah, it was a challenging conversation.
General Yvonne, whenever we called, what he always said was, what do you need, and how can I help? Without fail, no matter how exhausted and overwhelmed he and his team were. And so I want to thank you, General, for everything you and all of the Guard did to help us in the public health response. I lured our colleague Adelita Orafici from Rhode Island almost the day I took the job, and she was absolutely amazing in the office from the beginning and helped run the department and run the response. And the state owes her a huge debt of gratitude. So thank you, Lita. I'm sorry, Rhode Island, and it's their loss is Connecticut's gain. Same to Barbara Cass, who I will never forget at the beginning of the pandemic, when we had an emergency in an assisted living facility and that was understaffed, not enough PPE. Barbara just got in her car at 11 p.m. on a Saturday night, drove to the facility to do what she could with her background as a clinician to help the clients and the staff of that facility. She went where she was needed, and she never let up throughout the course of the pandemic. And she took a lot of heat for a lot of different trying to do the right thing, and we really also owe her a gratitude. And finally, I have to say thank you to Josh, who was my work brother, sibling, with whom there were conversations day and night, and whose really brilliant help throughout this was indispensable to all of us. I remember when one of the first meetings of the reopening committee that I listened in on, and it was about 10 p.m., and we'd been going since about 7 or 8 in the morning, and we just kept talking, and I just texted Josh and said, when do we eat? Because we really, and then I told Josh I thought he was like one of those plants that you can put on the wall and you never have to feed or water them because they just absorb nutrients from the environment. 'Cause he was always working. Anyway, enough of that. Thank you to all of you, and mostly to you, Governor, for your leadership on this. So the new normal, the public health emergency is ending tomorrow. But it was often my role at these events to be the Debbie Downer and the school marm a little bit. So I will remind everyone that COVID is still with us. And the difference that you saw in Commissioner's slides of nursing home deaths is that now we have the tools to treat the disease, but they're only as good as taking advantage of them. So if by chance you haven't been vaccinated or boosted, you can please take advantage of that. At-home tests are still widely available, and if you're feeling sick, don't just assume it's allergies. Make sure you test for COVID. Stay home if you're sick, and wear a mask if you have immunocompromised or you're around someone who is. And you can always go to our website for updates. There, now I've said it. So the governor mentioned where we are in preparedness, and I would say it's literally night and day. If there's something that's a stronger opposite than night and day, I think we're in opposite condition than where we were at the beginning of the pandemic. Literally millions of pieces of PPE that Commissioner Giuttani and her team have been managing in a warehouse to make sure that our home care workers, our nursing homes, our assisted living facilities, our hospitals, if they need it, everybody who might need PPE and not have it in the event of another pandemic, we're ready to go. We began, and Commissioner Giuttani has been continuing a closer working relationship with our local health departments, who are indispensable partners, but of which we have many in the state for a small state. We've seen that number shrink, and they're working more closely together. We have more health districts rather than individual health departments. So that's been a good next step for preparedness. In addition, we've made investments for the future, both to address some of the consequences of the pandemic that went beyond COVID itself, but also to make sure that we're prepared. So huge investments in ventilation in our schools and other healthcare facilities. $165 million invested in schools. And when the governor and I were speaking earlier about what some of the lessons were from COVID, I said, I think we underestimated the importance of something as simple as a fan or ventilation for restaurant safety, for school safety, for healthcare facilities. And we've made those investments, so the next time around we'll be ready. Our pharmacy partners have been absolutely amazing throughout this entire pandemic. That infrastructure helped us get our vaccine campaign off the ground, first in nursing homes and then in communities. And they are there to be vaccinators going forward. I think outdoor dining in a lot of ways has permanently expanded, and so that'll help us if in a regular flu season or a COVID outbreak, but it also just expands the availability and helps the industry. We've invested hundreds of millions of dollars in mental health services for both adults and children, because we know the isolation and some of the other impacts of the pandemic have had longer-term mental health effects. So we're doing more in schools, we're expanding our crisis response, and making those changes permanent. The health department has a much better data infrastructure. Josh had a 12-dimensional spreadsheet throughout the pandemic where he could always find a fact, but we've been building better infrastructure at the health department as a result of this, both to communicate with the public and with our federal partners at CDC, but also within the department. And a shout out to the hospitals who continue to share data with us on a daily basis about what's happening with COVID hospitalizations, and we're really terrific partners throughout the pandemic in making sure we had the data we needed. Our partnership with the long-term care industry is ongoing. Regular, Barbara and Lita can tell you, daily, weekly calls, hundreds of hours invested in training the long-term care industry on infection prevention, led by Dr. Vivian Leung, who was with the health department at the time. And that's made a huge difference in their ability to respond and their resilience. We mentioned the partnerships with hospitals. Josh and I were on the phone with them every single week, talking about how things were going, how we could partner, what they needed from the state, and how we could improve our response with their partnership. So really was an indispensable and I think model relationship for the country, the way we work together. And then finally, one of the happiest days of my life was when Commissioner Giuttani started her job at the Public Health Department. But I miss DPH, but I don't miss having two agencies. And I think the governor has directed us to work more as a team. He modeled it during the pandemic, and we have picked up that ball, taken it, and run with it. And I think you have a much more coordinated state government than we did at the start of the pandemic. And that is better for our citizens, it's better for our preparedness, and it's a better way to operate the state. So thank you again, Governor.
All right, Deirdre. One other change. We had a great friend named Scott Gottlieb on the board of Pfizer, former FDA, and I asked him what else, and he gave me something hopeful, I thought. He says, we were just desperate for the vaccines, waiting month to month. Maybe it'll be September, maybe then, not fast. He thinks that we'll be able to get very targeted vaccines out and available with the next strain of whatever it might be in something like 90 days. And you guys know a lot better than I do, but that's something that makes a difference. just circle back in conclusion to what, Albert said. A learning lesson. I used to think that healthcare was an individual right, and everybody had that individual right. And you didn't have to learn this, but I probably had to be reminded that healthcare is really a community right as well. And if you're not have the option of getting vaccinated, if you can't get a mask, if you don't have primary health care, you're at risk, and we're all at risk. Sayla there from housing. I mean, that homeless person doesn't have, I'm telling everybody, stay safe, stay home. What if you don't have a home? What if you're out in the street? What if you're out in the street and you can't get access to a vaccine? That's a reminder of how important public health is and what each and every one of you do. And just leave you on a personal note, a lot of folks are a little cynical about state government and guys leaning on shovels or something. I'm just reminded of what a meaning of a essential worker is and what each and every one of you did. I mean, I hear a lot about the greatest generation stepping up, battling in a war. And I'd like to think history is going to look back and say each and every one of you and a lot of folks did small things in a big way that made an enormous difference. And you are our greatest generation. For that, I'm so thankful. All right. Any questions?
Dr. Koh and Dr. Giuliani. We've been in situations before where COVID has kind of receded a little bit, and then it seemed like maybe we were in the clear, and then a new variant has come, or whatever, weather changes. So what gives you confidence this time around that things are different and that the emergency is actually over?
Yeah, so I think if there's anything that we learned during the pandemic is to expect the unexpected. We saw that, just going back in history a little bit, it's actually not that far away, but when we had the Provincetown outbreak, where people who were vaccinated got infected. But we learned very quickly afterwards that people who got vaccinated were still protected from dying from the disease. And that's what saved us. That's why mortality rates here were 10 times lower than in South Carolina or in Louisiana. I think the third thing is that how transmissible the variants have become. But given all that evolution, I think what's panning out is that each wave of these new variants that we're experiencing, the BQ1s, the BXX116s, that they're still that their virulence is much lower than what we experienced during that terrible first wave, but also what we dodged the bullet on during the subsequent alpha delta waves, that those variants are much less virulent. We still need to, bottom line, and I think Dr. Giuliani outlined it, what do we still need to do? We have to protect those who are vulnerable, particularly our elderly, from that. So I think that's the kind of the evolution, that we will have these new variants, that they may be highly transmissible, but they're going to be less virulent, and certainly much less than what we experienced in the beginning. And I think that's really the testament of Connecticut, is that we saved a lot of lives from the moment the vaccines. I think what Dr. Giuliani showed is that we saved a lot of lives between that and the Omicron outbreak, and that was all vaccination.
So I agree with everything Dr. Koh said, and I think the things I would add is that part of what the job in public health to do is to be prepared for the unexpected. So yes, we think that a lot of the collective immunity that we have is going to help us. We've seen that with each subsequent wave that we've seen. But is there the possibility that there will be a curveball? That is possible. What we're going to need to be able to do is be prepared to be able to deal with that. Our PPE stockpile is one measure of that. Our ability to do sequencing in our lab of wastewater, to be able to identify those new variants that might be coming, to be continuing to do the surveillance and looking for potentially pockets where there may be disease emergence that may happen. That's exactly what public health does when everybody else sort of goes back to their regular lives. We continue doing that work so that we can be prepared for something that may be on the horizon. And that's what we were going to continue to do in the department.
There's a lot of early on about taking COVID positive patients from the hospital and before sending them straight home, housing them in nursing homes. New York also had an issue with that. Would that be the plan moving forward if we had another outbreak?
So I don't know if Dr. Gifford was there in the beginning, but I don't think that's what we did, but I'm going to let her speak to that.
So, thank you, because there has been some misconceptions around how Connecticut managed that, and I want to make clear that nursing home residents live in the nursing home. That is their home. That's their place of residence. So when they have been treated in a hospital and are well enough to be discharged, they're discharged to their home. When we had hospitals and emergency departments overflowing with very ill individuals with COVID, and individuals who were well enough to be discharged, we needed to send them back to their place of residence. In some cases, that was a nursing home. We did two things, the governor did. First thing was we set up these COVID recovery facilities. So Connecticut was one of a few states that did this. These were wings of a facility or specialized freestanding facilities that were built to manage COVID positive residents who needed a nursing home level of care. We had strong partners in the industry who did that for us, and that was a way that residents could continue their recovery when they didn't need a hospital level of care but could be in a nursing home. Second thing we did, I mentioned Dr. Vivian Leung and the healthcare acquired infections team at the department. Hundreds of hours working with nursing home staff, training them on something called cohorting. So you had patients that were exposed to COVID in one part of the nursing home. You had patients that were COVID positive in another part of the nursing home. And you had patients that were unexposed in other parts. And they were cohorted, they were segregated. People changed their masks and gloves and gowns when they went between those three groups. So the way that nursing home residents were managed was, by doing what was recommended by the CDC, which was these cohorting and then testing once we had testing. And then Connecticut layered on top of that with our COVID recovery facilities that we kept going through, most of the first two waves, I believe, of the pandemic.
We're expecting changes to co-pays, Paxlovid and other treatments, and we've got people through the crisis phase. So for those where find where economics is a barrier, and there are people that will not be able to afford pay full price, do we have support systems in place for them?
So I think the first thing I would say is what we're seeing is the evolution of COVID being internalized as another health condition that affects all of us, and the same systems that are in place to help manage the management of health care in the usual delivery of care is where COVID is ending up. And so we're emerging from the federal response where vaccines were free, where medications were free, where everything related to COVID was essentially covered, to integrating that within the regular healthcare delivery system. And so the safety nets that you're talking about, which we need in our society, are the same that exist for all the other health conditions that we have in our society. We rely on our FQHC partners. We rely on Medicaid. We rely on the expansion that's happened within our state. There have been so many efforts to try to plug the holes to have as many people in our state covered as possible. And that's where our partnerships within the state with other types of agencies that can provide those services are really going to come into play.
So with this transition, could we say that we are now in the endemic stage for COVID?
So I think that we are at a phase where we will say that we are in a place where COVID is part of our society and is part of what we are living with. That does not mean that there aren't going to be times when we have resurgence and we have to deal with that. But we do recognize that 3 years into this, the virus is not going away. The virus will need to be managed. My hope is that it's going to be managed on a seasonal basis. But what we've seen over the last 3 years is that there were times at other times of the year where we did see spikes. And that's why I say that we continue to learn about this virus every single day. And when life is going back into normalcy, how that will play out is anybody's guess. I hope it's a seasonal virus so that we can deal with it the way we deal with other respiratory viruses, roughly between October and April every year. But we will need to be prepared for the unexpected.
Thank you.
The last couple weeks, Connecticut has reported something like 12 COVID deaths or something like that, which, from my understanding, is more than you would see for the flu. So to what extent is it true that COVID is kind of just another virus or another disease, and to what extent is it still kind of a more serious threat than some of these other viruses?
So I think for those that often want to equate COVID with the flu, I agree with you, Alex. It's not the same. COVID is still more deadly than the flu is. That's a reality. But it is similar in the sense that it is becoming part of our regular life. Most likely, we are going to have to be thinking about getting vaccinated again in the fall. Most likely, you're going to be thinking about it the way you would other respiratory viruses, where you see more of them as we go through the winter season. So you're absolutely correct that it is not necessarily the same, but we can think of the approaches, since the approaches of all respiratory viruses are essentially the same, that we can approach prevention to them in a similar way. So for anybody who did not get a booster in the last year, you're eligible. And so, you know, we've had a little over 800,000 people who have gotten boosters of the newest vaccine, you know, starting last fall. Having said that, we do know that cases are low right now, and likely we are going to be looking at maybe something like yearly vaccine. We don't know that for sure, but that's probably the direction that we're headed. And so I would say as we get into these fall months and cases go up, you should be prepared to get vaccinated.
What role, if any, will state government play in future booster rollouts?
This is going to be part of routine public health messaging that we usually do. So part of what we do every single year is try to make people aware about getting your flu shot as you go into the fall. And we have campaigns that run through our local health departments, working with them. We work with other partners throughout the state. We look at what our rates are, where can we go, and try to target communities, and I envision doing the same for COVID.
Was there, what percent, I think it was 13 or 14% of nursing home residents did pass away, and I wanted to know how, if that's correct, and what is the percent, and how that compares to the nation. Also, what's the overall death rate over the 3 years in Connecticut compared with the nation? And lastly, in respect to nursing homes, is there, understanding the protocols that have been described, is there anything that the administration would have done differently?
And that's going to be our last question.
Maybe I'll just start with the fact that, again, we got hit very early on when nobody really knew anything about this virus, and so there's no question that we had a lot of nursing home deaths in the beginning. But from that period of time, the deaths trickled off dramatically, as you could see in that chart. And so that's where it gets challenging in terms of comparisons, because not everybody had the same exposure to the virus in other parts of the country that Connecticut did right out of the gate in the beginning.
Maybe I can just add to emphasize some of the points that Manisha said. So first of all, I think that first wave, 11% of our nursing home residents died. I think it was a testament to, I see Lita here, but and certainly Commissioner Gifford, that what happened after that terrible first wave was completely mitigated, and compared to other states protecting that vulnerable population nursing home, Connecticut far outstripped many of the other states, and there's evidence for that. The second, I think, one of the questions that you raised is how did we compare to other states, and even if you include that first wave where we got blindsided, you could say, along with New York, a lot of the Northeast. If you include those, our outcomes here in Connecticut, and especially the outcome that's most important is that equity gap, that health equity gap between our most vulnerable populations, the inner cities, and our Latino and African American populations. They were much smaller than, for example, the South, the Midwest, and even the West Coast. Overall mortality, from that. So there's clear evidence that those policies worked, and actually those policies were, as the governor had mentioned, were ones that were translated to other states, other states in the union. And I think the last thing that Commissioner Giuttani mentioned was that we're out of the pandemic, right? The public health emergency is over. We have endemic transmission, but we still have 200 Americans dying every day of COVID, right? And we have a lot of Americans dying from influenza. But the tracks or the foundations are in place, both at the healthcare systems and in the state, for all the work that I think Deidre very nicely summed up. That we can get them the right tests, we can get them the right therapy, and we can get them the right health care and the vaccinations to protect them. So I think that's the bottom. I think that's kind of the bottom line with just picking up on what Commissioner Giuttani had mentioned.
Yeah, another way of saying it is just during those first 3 or 4 months, we had the highest or one of the 3 highest fatalities per capita in the country. You stretch that out over the last 2 years, we're about average. Nothing to boast about, but we did much better. If you take out those first 3 months, we were much better than our peers. And we would not be able to say that except for the good work of each and every one of you. Thanks, everybody.
Thank you.